April is Mental Health Awareness Month, and it is no small problem. 1 in 5 Americans say they're living with a mental health issue. That's nearly 50 million people, a number that seems to keep going up, especially among younger generations. Here to discuss it, Dr. Anil Sharma, Vice Chair of Psychiatry at Dignity Health Northridge Hospital. Thanks for joining us this morning. What do you think's behind the rise in mental illness? Is it the pandemic, inflation, politics, all of the above?
Thanks for having me on your show. When it comes to causes of mental illness, these are multifactorial. There are several factors. You cannot pinpoint on a single problem, but we all know pandemic has created a lot of problems. There are no new studies, but some surveys say like 4 out of 10 people are suffering from some kind of mental stress or mental illness. It could be stress related, could be pandemic. And when we look at pre-pandemic ratio, it was only 1 in 10. So if we look at these surveys, they say mental illness has increased at least fourfold during the pandemic.
Yeah,
And again, as I said, these are multifactorial, could be financial, social isolation, etc.
Doctor, I was going to say the pandemic really took a toll on kids in schools. I know I had a teenager at home doing remote learning for over a year, and I could tell it was not good for her, and I know it was not good for a lot of other kids.
No, we were seeing more patients coming to the hospital, to the clinic with similar issues like social isolation, increase in substance abuse issues, financial stressors. And when first pandemic started, people were under so much stress, we didn't know what to expect. Should we wear masks, not wear masks, take this medication? How do we protect ourselves? So that took a toll.
Yeah, and I think it's still very stressful for a lot of people. Do you find that people wait until they hit rock bottom to seek care? When should people start seeking help?
So people wait way too long, probably because of stigma, because of lack of awareness, how to get access, and also lack of access. So if we talk about the stigma, there are several types of stigma. The most important or most common one is public stigma. There is stereotype about mental illness. There are some, and when there's so much social stigma, there's also public stigma. People internalize that social stigma or public stigma. There are standardized stigma or structural stigma where some people with mental illness find it difficult to get a job. So when you see people with the first sign of isolation, withdrawn, drinking more, using more substances, not talking to their friends or family members, their school or job performance is decreasing, that's the time to get help.
And doctor, getting a person help and broaching that subject with them can obviously be difficult. Any suggestions?
So it's difficult because of several factors. There's mental health can be expensive. Therapists and psychiatrists, they have a long waiting list. Sometimes insurance have carve-outs, or some providers do not take your insurance. So people should try to get some help right away, but I also believe a lot in preventive behavioral health. Like, people should take care of their physical health. As we know, a healthy mind lives in healthy body. So take care of your personal health, exercise regularly, eat healthy. What happened in pandemic? People were not taking care of their mental health and also physical health. So that took a toll as well. Like people who have certain illnesses are more tend to feel depressed or anxious. People with chronic medical illnesses, diabetes, cancer, so even hypothyroidism, there's high risk of depression. So physical health is important. Stop drinking or at least cut down on drinking or drugs. Stay connected with your friends, with your family members. If you have burned the bridges, rebuild those bridges.
And
Be
doctor,
positive.
and doctor, the pandemic kind of coming to an end in terms of some of the restrictions. Are you seeing people doing better, not as many people coming for help?
So I think there's a lag time. We are still seeing people under a lot of stress. They are still living with stigma, they're still living with some high level of stress and worries. They don't know what's going to happen to them. But we are seeing things are turning around for good.
Okay, well, hopefully that is encouraging news, and let's hope it continues. Doctor, thanks for joining us today. Certainly appreciate the information and the advice. We appreciate it.
Thanks again.
Thank you.